Welcome everyone to our Peer-to-Peer Solutions Center, Chaha'oh, Gathering of the People. As the experts in this session, our presenters from NCUIH will share how UIOs can best utilize technical assistance, training, and support that NCUIH offers. My name is Siegel. I'm a public health associate with the Technical Assistance and Research Center, better known as TARC, at NCUIH. Joining me from the NCUIH team today are Elizabeth Best, Public Health Manager, TARC, Nahla, Holland, Research Associate, TARC, Mary Jomia, Policy Manager, TARC, and Sean Bitsui, our Communications Associate. We are honored here to have you today. We kindly ask that you place your name, organization, tribal affiliation, and title into the chat. In addition, we welcome any feedback that you would like to provide about your webinar experience in our survey, which will also be posted in the chat box. Next slide, please. Next slide. Perfect. I just want to start off with a quick disclaimer. This event is made possible by the Indian Health Services Cooperative Agreement Fund. This event is solely the responsibility of the National Council of Urban Indian Health. It does not necessarily represent the views of Indian Health Services or the Department of Health and Human Services. Next slide, please. For those of you that are unfamiliar with NCUIH, here's a little background. The National Council of Urban Indian Health, also known as NCUIH, is a national nonprofit organization devoted to the support and development of quality, accessible, and culturally competent health and public health services for American Indians and Alaska Natives living in urban areas. NCUIH is the only national representative of 41 Title V urban Indian organizations, or UIOs, under the Indian Health Services and the Indian Health Care Improvement Act, or IHCIA. NCUIH strives to improve the health of the over 70% of American Indian and Alaska Native population that live in urban areas, supported by quality, accessible healthcare centers. Next slide, please. Just a quick reminder, this session is being recorded. All mics have been muted upon entry. We always encourage participation and engagement in today's sessions. We invite all participants to turn on their cameras and posting questions or comments in the chat box. There will be opportunity at the end of this session to ask any questions and have a quick Q&A session and discuss anything throughout the agenda today. Next slide, please. This slide features some information on how to use Zoom. For those that are unfamiliar with Zoom, you will have already seen this. At the bottom of your screen, you can find the chat box feature. Click on that to enter the chat. Please enter your comments and questions there. Additionally, feel free to use icons, emojis in the chat throughout the session. Next slide, please. Please note the QR code on the slide. If you can scan it with your phone or tablet, you'll be taken to our session feedback survey where you can leave comments on what you like most and how we can improve these sessions. Your participation and your feedback is always greatly appreciated. You'll be also having that code again in the chat box and towards the end of today's presentation. Next slide, please. As shown on the agenda, we will begin our presentation at around 2:10 Eastern Standard Time, although I think we're doing good on time today, followed by a quick Q&A session at 2:50, and we will end with our evaluation and upcoming events and adjourn at 3 p.m. Eastern Standard Time. Next slide, please. The learner objectives from today's sessions are exploring types of technical assistance and support available and learn how to request assistance, develop a basic understanding of the different ways NCUIH supports our urban Indian organizations through sharing available resources on NCUIH's website, including our Knowledge Resource Center, learn about how to request information from our Knowledge Resource Center, policy requests, data requests, technical assistance requests, and gain awareness of our communities of learning webinars and additional NCUIH events which feature leaders in the field. Next slide, please. The Chaha'oh is a Navajo word for shade, shadow, or sun shelter. The construction techniques was once commonly used in the building of pit houses. Unlike Pueblo Ramadas, Navajo shades seldom have earth-covered roofs and use leafy branches for covers. Chaha'ohs range in size based on materials in the area and family need, and is rarely finished because it requires constant care. It serves as a warm, inviting place to gather, socialize, listen, laugh, and cook. For those interested in learning more about Chaha'oh, please review the video link that is inside the chat box after today's presentation, and you guys can get a feel of how we chose today's name. Next slide, please. going into the meat and bones of today's stuff. The National Council of Urban Indian Health provides a plethora of services to urban and Indian organizations, such as services you see here on the screen. In the upcoming slides, we will go over the services provided and how to request services in our policy, technical assistance, and research center. Next slide, please. The last slide lists all the services NCUIH provides, but as a member of technical assistance, we provide a diverse backgrounds in areas such as local partnership development and staff training. My own background is as an epidemiologist, with a focus in youth-centered care and communicable and non-communicable disease prevention measures. This diversity in TA and the rest of NCUIH allows urban Indian organizations to contact a subject matter expert no matter the issue. The points listed on the slide are just a handful of the services we provide. Next slide, please. Technical assistance is a term used in public health to describe topic-specific guidance tailored based on need and coupled with use of innovation technology, guidance tailored based on the need and coupled with the use of innovative technology to facilitate capacity building of organization. This includes, but is not limited to, increasing knowledge on status satisfaction of the current needs for assistance, ensuring we have updates that includes policy and evidence-based research, providing mentorships and networking opportunities, as well as providing program organizations, marketing, development strategies, informed policy decision-making, and so much more. Next slide, please. When TA is requested, the process is broken up into 5 parts. After you submit a technical assistance request, you'll receive a courtesy email saying the request has been received and is being reviewed. All requests will be triaged within 24 business hours. Once it is reviewed internally, the request can either be approved or denied. It is not often we deny requests, and we always give reasoning why. Like maybe the time or the resources or the request just isn't within our wheelhouse, but we always give a reasoning why. If your request is approved, a one-on-one technical assistance request consultation is scheduled with you and your team and will feature subject matter experts on hand. An action plan is developed, followed by a satisfaction survey before the TA request is closed out. No 2 requests are the same, and often multiple TA requests are from a single entity and will be completed. Sorry, getting tongue twisted. Multiple TA requests from a single entity will be completed by multiple NCUIH staff. So maybe your question is threefold. You have one part from policy, maybe you need some stuff for research, and maybe you need someone to review some documents, technical assistance, all with inside one request. We make it easy. We give one response email back, and we make sure that we're timely with all of our support. Next slide, please. The technical assist request form seen on the slide can be found on the NCUIH website under the tab Technical Assistance, One-on-One Technical Assistance. The website page will bring you to the technical assistance request form towards the second half of the page. So pretty easy. So a little red circle. Next slide, please. Once you click on that, the technical assistance form on the website looks like this. 4 questions are asked: your name, your organization, your email, and the type of technical assistance you are requesting. The type of technical assistance needed features a drop-down tab and offers a other option if the drop-down options listed do not suffice. There is no general time frame from when requests will be closed out and finished. It all depends on the type of assistance needed. We encourage you to type out all questions about the request in the How We Can Help section before submitting a request. Our request will be triaged within 24 business hours. Next slide, please. These are 5 real TA request outcomes within the last year. I have taken off the requester's information to respect their privacy. 3 separate urban Indian organizations were assisted in developing new comprehensive emergency management plans. The NCUIH technical assistance reviewed and revised a urban Indian organization suicide prevention flowchart. In a much larger request, the NCUIH technical assistance trained urban Indian organization staff on the community reinforcement approach, CRA, an alcoholism treatment approach that aims to achieve abstinence by eliminating positive reinforcement for drinking and enhancing positive reinforcement for sobriety. Quite a handful, mouthful. Next slide, please. The follow-up satisfaction survey sent out after finishing our quest has a great impact on the work we do at NCUIH. Feedback, good, bad, or indifferent, not only helps us to improve our services, but also understands the need of our urban organizations. Identifiable information is never shared out, and the survey email out will only take a moment of your time. And with that, I want to thank you for listening to a little bit more about technical assistance with NCUIH. I would like to pass it on to Nahla Holland to talk about the other half of TARC, NCUIH's Research Center. Next slide, please.
Hi, everybody. I'm Nahla Holland. I'm a research associate here at NCUIH, and I'm also a member of the Eastern Pequot Tribal Nation here in Connecticut, which is where I'm located. And I will be sharing with you all some research resources on our website. So research has two main services for UIO staff and the public to utilize on our website: the Knowledge Resource Center, which I will call the KRC, and the Research and Data Request Submission. On the research page at NCUIH.org, we also have a research blog and pages for all our main projects that research and public health work on. So traditional healing, maternal health care, racial misclassification, to name a few. But what distinguishes the KRC and the Research and Data Request Form from those other pages is that the KRC and Research and Data Request Form are interactive and allow for submissions in collaboration from UIOs and the public. So the KRC is a keyword searchable resource-centered database developed by us to help educate people that work with Indian country on issues specific to urban American Indian Alaska Native population. And you can submit resources to research@NCUIH.org. And then we have the Research and Data Request System, and that is a form that UIOs and other individuals, if they want, can request NCUIH's data team to support them with their data evaluation needs. And you can submit us a request by using that form on our website, and I'll explain how to do that in a minute. Next slide, please. So let's focus on the KRC for right now. So the KRC is updated at least once a week by NCUIH staff with a new resource, and this can be, usually it is peer-reviewed journal articles specific to urban American Indian Alaska Native populations. But you can also find fact sheets from the American Diabetes Association, policy white papers, toolkits from We Are Native on sexual health, and social media campaigns, just to give a few examples. And then on the slide, we have some examples of NCUIH developed resources that we share on the KRC. So the first at the top is a NCUIH developed resource sheet for MMIP related causes. And so it has links to data and databases for MMIP, and well as links to webinars and toolkits and hotlines for MMIP related issues as well. And then we also, on the bottom, we have a one-pager. And the one-pager is how we share peer-reviewed content with everybody that is behind a paywall. So we can't necessarily share the article with you all on the KRC. So if there's a paper that looks interesting to you, relevant to you, or anything, you just want access, you can contact us at research@NCUIH.org and send us that link to that article, and we will be able to buy that article, share that PDF with you, and then develop a one-pager of the main takeaways from the article for the site and for you to share with your team as well, so that everybody is getting access to the main takeaways from that article in any way possible. And then we also do take submissions from UIOs and the public, and we would love to be able to share any research, papers, reports, and other resources that you all develop for your UIOs with the rest of Indian country. And I'll provide the link in the chat of those two resources for you all to check out if you're interested. Next slide, please. So finding the KRC, where is the KRC? So the KRC is found under the research tab on the NCUIH.org website, under Knowledge Resource Center in that drop-down menu. It's that first option. And finding an article in the KRC. So if you're looking for articles or resources on a specific topic using the KRC, there is a search function that will pick up words in the abstract or keywords in the keyword tab. However, if it's a topic we do frequent grant work with and you don't have a specific keyword in mind, so for example, we do a lot of grant work with MMIP and maternal mortality and COVID-19. So we have tags dedicated to those projects to find articles about that. And then we also have categories, which is the most general of the search functions. And so if you don't have a specific topic in mind, but you know you want to look at health articles, best practices, or just like research, that's also an option for you to select from the categories. Next slide, please. So research and data recs. So if you aren't finding what you're looking for in the KRC, or if you want to know more about a certain topic related to the KRC, you can always send us a research and data request. So this doesn't have to be a super elaborate request. It can just be what are vaccination rates for shingles in my state for American Indian, Alaska Native compared to American Indian, Alaska Native populations compared to some other population. Or it can just be what is the current literature for Indian country on dental health. It can just be more of a question than an actual anything else. So these are some examples of what we do is included in the data request that we do for NCUIH and for UIOs. The two examples on the slide show previous data requests. The top one is a report on COVID morbidity and mortality for American Indian, Alaska Native people compared to the rest of the country. And that's a report of information that we didn't necessarily collect ourselves. We just found, we used a bunch of different sources available on the web and added that all into one report for the requester so that it is easier to share that information with their team. And then the second on the bottom is a Qualtrics dashboard. And for those of you who aren't familiar, Qualtrics is a platform that allows you to store, input, and analyze data. And the dashboard feature allows you to interact with data in a more different experience. So if you have Qualtrics already, or if you are interested in a dashboard, we can input data for you into Qualtrics, and then the data team here can help you set up a dashboard to allow staff or your UIO better comprehension of the data available to them. This example on the slide is a dashboard we created for NCUIH, and it shows the popularity of traditional healing UIOs. And it's a lot easier to tell which ones are most popular. The one that is bolded in blue is talking circle, that's the most popular across all UIOs, and pretty easy to tell based on information like that. All right, next slide, please. So hopefully this has inspired you all to submit a data request. So I'll walk you through the process to make it easier for you all later. So you want to go to our NCUIH.org/research page and then scroll down to that turquoise button that says, oh, and then click please. Sean, next slide. And then you're going to click that turquoise button that says research and data request. Next slide, please. And then you should be sent to an Asana form that looks like this. Here you will fill in your information, like what organization you're with, a person of contact, the time frame for completing this, and some info on what you're wanting from this request. Once you hit submit, this will automatically get sent to me, and then the data team will get into touch with you within 48 hours to schedule a meeting to discuss your ask. And if you forget what the button is, or you have any questions whatsoever on research at NCUIH, please feel free to email us at research@ncuih.org, and we can help you out. And next slide, please. And this is feedback we received from our data request. You make my job so much easier when I ask for help. Thank you. I think we all want to make our jobs a little easier. So please use the research and data request form to allow us to help you do that. And I will now pass it over to Mary to talk about our policy resources.
Thank you, Nahla. Hi, everyone. My name is Mary Jomia, and I am the Public Policy Manager in our Policy Department. And I'll just share a little bit about our department and the resources that we provide. Next slide, please. So our Policy Department represents urban Indian health providers and urban Indian communities to national stakeholders in support of increasing access to care. We're made up of a Congressional Relations Division, a Federal Relations Division, and a Legal Counsel. So we establish legislative priorities, track development and implementation of federal legislation and regulations, and work to protect the interests of urban Indian populations. NCUIH also educates other audiences, such as research institutes, foundations, and federal and local agencies on the impact of federal policy decisions. We do this by creating educational tools for policymakers, members of Congress, and the general public about the healthcare needs of Native Americans living in urban communities, which I'll expand upon in the next few slides. Next slide, please. So this is just an overview of the resources we provide and what you can find on the NCUIH website under the Policy Resource Center. We have a policy blog and a policy newsletter to get the word out to the public on pressing urban Indian policy news. We also complete an extensive assessment process to create annual policy assessments and policy priorities documents. We have a legislative tracker and a regulations tracker available on our website where you can view the different bills and regulations that we're monitoring that affect UIOs. We develop educational infographics on issues affecting the urban Indian community, and we develop advocacy toolkits for the general public to join us in the push to advance health equity among the urban Indian population. Next slide, please. So NCUIH provides ongoing policy updates and legislative alerts on topics pertaining to urban Indian health and urban Indian communities through a variety of platforms. Like I mentioned earlier, we have a policy blog and a policy newsletter to periodically get our information out. Additionally, we send policy alerts and press releases for more pressing immediate matters. Some info that you might find in these communications is, information about a bill that recently dropped or became law that affects UIOs, upcoming events, recent comments we've submitted to federal agencies, and so on. Next slide, please. As I mentioned, we have a legislative tracker and a regulations tracker on the Policy Resource Center site. So as a service to its members, NCUIH tracks and monitors legislation and the development of relevant regulations and proposed agency actions that impact urban Indian organizations or directly affects their operational growth, financial structure, and service expansion. Our legislative tracker is an interactive tool where you can see bills that NCUIH endorsed because of the impacts on UIOs. Bills that may impact UIOs but have not been endorsed by NCUIH, and bills that NCUIH has championed. And you can filter by issue area, congressional chamber, and bill status. And then our regulations tracker is a formatted table that lists on a continuing basis pertinent information to UIOs as it relates to key executive orders by the president and other regulatory actions by federal agencies. There's also a document that provides a summary of these regulations. It's not inclusive to all regulatory changes, and it's not intended to be a suggestion for action, but rather a source of information. Next slide, please. So every year we release our annual policy assessment, which contains information collected from a series of focus groups that we hold with urban Indian organization leaders and a questionnaire that identifies the needs of UIOs. And along with that, we also compile a list of policy priorities every year that outlines the most pressing congressional and federal issues for UIOs. The policy priorities are informed by our annual policy assessment and what UIO leaders identify as pressing needs. And you can find previous annual policy assessments and priority documents on our Policy Resource Center. Our 2022 policy assessment and 2023 policy priorities documents will be published on our website very soon, so keep your eyes open for those. Next slide, please. And lastly, I just want to highlight the different informational infographics and one-pagers that we produce. We create these based on health policy issues affecting urban Indian communities using data and research. These are helpful in our advocacy to show the need for legislation and federal changes to address health disparities among urban Indian populations. In the Policy Resource Center, you can find infographics on topics such as Medicaid unwinding and the impact of the end of the COVID-19 public health emergency on UIOs and urban Indians, native data on COVID-19, native data on maternal and infant health disparities, US healthcare spending data on American Indians and Alaska Natives and IHS, and much more. So that's on the infographics, and that's all for me actually. So if you have any questions or need help contacting your member of Congress or just want information on policy matters, please reach out to our department at policy@ncui.org. And now I'll pass it back to Liz to talk about our communities of learning.
Liz, you're on mute.
Thanks, Molly. Hi, everybody. I'll start that over. My name is Liz, and I'm a manager of technical assistance in the TARC department. I develop content and manage many of our learning events here at NCUIH. Here at NCUIH, we pride our learning communities as innovative and communal spaces to come together to share information on common concerns, questions, or challenges that you may face in your day-to-day work. Recognizing that we learn best through peer-to-peer exchange, our learning sessions are always interactive in nature. We bring in leaders in the field to lend their expertise and insight, and our goal at NCUIH is that you leave each learning session ready to learn, ready to put what you have learned into practice. Next slide, please. Learning communities provide a space and a structure for people to align around a shared goal. Last year, NCUIH hosted 46 learning events. And as we design our programming, NCUIH listens to your needs and designs tailored content and resources to support quality healthcare delivery. The community of learning operates in virtual classrooms that enable urban Indian program staff and leadership to gain best practices, knowledges, and share strategies and solutions in a safe and supportive environment. And here are just some of the event highlights over the last year. We have many different formats, from podcasts to hosting on Project Echo to learning series, which tend to be 3 sessions in nature. We have webinars, an event for UIO boards, and then our open forums, which is what we are at today. We also host an annual conference. Next slide, please. All of our events are archived on NCUIH's website, and this is just a screenshot of what our website looks like. Each archived event shares the live recording, the slide decks, and if available, a one-page key takeaway document that you can share with your teams. Some of our recent events include topics such as accreditation, behavioral health topics, best practices in grant writing, and a new format of on-demand training on person-centered care. Next slide, please. Your feedback on our learning events is important to us, and we consistently monitor our effectiveness in our classrooms. Based on the feedback we receive on our evaluations, we are proud that we are striking the right chord with those attending our workshops throughout our UIOs. Next slide, please. As you can see here, we have many magnificent events on the horizon. On March 14th, we will kick off an informative HIV Community of Learning series titled Rooted in Resilience, Urban Indian Harm Reduction for HIV Prevention. We are continually adding events, and these can be found on our website. So sign up for our newsletter, as well as we have an event newsletter that comes out bi-monthly, and visit our website often to learn more about upcoming events. Next slide, please. We are also excited to announce that our registration is now open for our 2023 annual conference, and we are thrilled that we will finally be back in person. This event runs from Monday, May 15th through Thursday, May 18th, and will be held in Washington, D.C. The theme of this year's conference is honoring our ancestors and preparing for the next 7 generations. NCUIH celebrates 25 years of health leadership. We hope to see many of you there. Next slide, please. And before we wrap up, I wanted to share a little bit about our amazing and dynamic Youth Council. Our Youth Council is currently in their 5th cohort, and this year's Youth Council is made up of 5 amazing and inspirational young leaders. NCUIH's Youth Advisory Council amplifies the voices of young American Indian and Alaska Natives and seeks to develop a community-driven and comprehensive urban youth suicide and substance abuse plan for urban Indian communities to provide prevention and recovery services to youth age 24 and under. Youth council members will promote among peers this year through a social media campaign on a local and national level on topics including substance misuse, trauma, suicide prevention, mental health. So watch out for more to come on that. Next slide, please. So special thanks to all of our NCUIH speakers today. We would now like to play a quick game of Kahoot to recap some of today's presentation before we go into our Q&A. So take out your phones if you have one. If you don't, you can type in the Kahoot link into your computer and enter the game code, which is 977409. And Sean, when you're ready, if you could please put it up, and we'll also drop the link and the game code into the chat. Awesome. And we tend to use Kahoot quite a bit in some of our learning events, just as knowledge checks or icebreakers as well. Let's get a few more people in. Smiley face in there. All right, I think we'll start. The technical assistance and research center support does not include right? The majority of us got it right. The answer is campaign financing. We get MB in the lead. True or false? You can submit your own resources to NCUIH's Knowledge Resource Center to be posted. The answer is true. You can submit your own resources to our Knowledge Resource Center. And I think Nahla has posted the link to that in our chat. MB is still in the lead. Which kind of resource is not found in the Knowledge Resource Center? An MMIP resource sheet, NCUIH's monthly report on adult vaccination equity for natives, Raven, peer-reviewed article on sleep health in Baltimore AIA and teens, or a research and data request form. Yep, the answer is research and data request form. So if you have some time when we jump off, feel free to hop on our website and visit the KRC. MB is on fire. All right, next one, please. To fill out a knowledge request form, you would fill out a TA request, fill out a research and data request form, email research@ncuih.org with the attached resource, or email communications. The answer is email research@NCUIH with the attached resource. Have you ever requested technical assistance? There's no right or wrong answer here. We just want to see if you guys have ever requested it. No. Well, hopefully through Molly's discussion on TA today, you'll see how easy it really is to submit a TA request form and on a variety of topics. I was aware that NCUIH had a knowledge resource center. Again, no right or wrong answer here. Great. I'm glad that people know that we do have a knowledge resource center. Which technical assistance or what type of technical assistance would you find most beneficial now at your UIO? Policy TA, KRC, TA, or anything else other? Please put it into the chat. Only one person has a need now for other. An awareness question, NCUIH has a new bi-weekly events newsletter. True or false? Yep, everybody got that. So hopefully you're opening it when you receive it to learn about our great events. The number of NCUIH events I've attended in the last year, 2 or less, 3 to 5, 6 to 8, or too many to count. Awesome. Glad to see that green is in the lead. And as I said, we had over 40 events last year. We're on par for that this year as well. I prefer on-demand events, listening to podcasts, live events, or a combination of different types of learning events. Great, different types of learning events. And our last question, the best day for me to attend learning events is a Tuesday, Wednesday, Thursday, or no preference. No preference. Awesome. Well, thanks everybody for playing. And then again, in a lot of our learning events, we tend to use Kahoot or other platforms to make things a little bit more fun and interactive. Now we'll open the floor if anybody has any questions on today's presentation or any of the offerings that NCUIH has for our UIOs. And you can either drop something into the chat or feel free to raise your hand. I have one that just came in to me. How long does it take for the data team to complete a research and data request? I guess that would probably be for Nahla.
Yeah, so we ask when you submit a data request, you'll see when you select a due date for us, you'll see that we ask at least 2 weeks to complete a data request. Obviously, not all research and data requests will need 2 weeks. In that initial meeting, we can discuss a timeline, and depending on the ask and the lift of that, we'll give you a better estimate of when things can be finalized and sent over to you. So generally 2 weeks, but if it's pretty easy, maybe less than 2 weeks.
Great, thanks, Nahla. Our next question is from Keith. When is the next CIC training scheduled? Let me pull up the events. I think they have been doing those types of trainings monthly, but I might have to get back to you because I don't have that answered. And I know Tiffany works on those, and perhaps she is working on that. But maybe somebody else on the panel might know when the next CIC training is being held. If not, we'll make note of it, and we can get back to you on that piece. Great. One more question that was just messaged to me. I know that you sometimes profile UIOs and the programming and work that they are doing. How can I suggest a topic for a webinar or a community of learning? That's a great question. We're always looking to highlight some of the programming that you're doing. And often from time to time, we'll reach out to our UIOs. We have a number of grants focused on a number of different types of topics. So if you have some interesting work that you're doing, I know in our last Peer-to-Peer Solution Center, we focused on the future of telehealth, and we did profile the work of one of our UIOs who is doing great work, starting with COVID and doing a lot of really innovative things, and really being able to infuse traditional culture into telehealth platforms. So that was exciting to learn. But if you guys have any ideas for webinars or would like to be profiled yourself, you can please send me an email and we can set up a time to talk. I will drop my my email into the chat as well. So Keith had another question. I'm not sure I understand. Steps to UIO membership or recognized associate? Do you want to come off mute because maybe I don't have the answer, but maybe I'm not clear what you're asking.
Hi, we're just becoming aware of NCUIH, and we just wanted more information on how to get more training, just things that you had already earmarked in regards to just having a continuous and regular relationship with NCUIH.
Yeah, I think, you know, to learn more about our work, you can certainly send a TA request or reach out to me, and I can get you in touch with the right person, you know, to learn more about how we might be able to assist with you with different things. Molly just dropped the TA request form into the chat. Well, great. Any other questions today? Awesome. So we'll continue. Our next slide, please. So yeah, our last slide is just an evaluation reminder. After all of our events, we kindly ask all attendees to complete an evaluation. This will be an opportunity just for us to gather some information to continuously improve our programming and our webinars. This was, you know, just a session to hopefully highlight some of what NCUIH can offer. But we're here for our UIOs, so never hesitate to reach out if we can be in assistance in any way. We will also follow up by sending these slides out, and we usually send just a one-page key takeaway sheet. So all of those great little links to the forms and our emails will all be in that as well. So you can, take a look at that. And if you need to request more information, everything will be right at your fingertips. Well, awesome. If there are no more questions, then we'll conclude this session for today. And I want to thank everybody for taking time out on this first day of March. And I wish you all a wonderful rest of your week. Thanks so much.